Welcome. Never before has it been so important to rebuild and reimagine our health systems. In the second of our webinars on building resilient health systems, we're going to look at data and the key role that can play in ensuring that health systems are more efficient, sustainable, resilient, and better prepared for the next global health crisis. And I am really pleased that so many of you have taken time to join us today. There were 1,300 people who registered, and they're coming from all over the world. We have people from Algeria, Brazil, Canada, Egypt, Romania, Lebanon, the US, the UK. So thank you very, very much for joining us for this session, which is the Future-Proofing Healthcare Initiative, which is sponsored by Roche. So if you're joining us and you're wanting to join us in Spanish, you will see that at the bottom of the screen, there's a blue bar, and you can click on there and you can change language from English into Spanish. We'll also be taking questions, and you'll see that at the top of the screen, there is a question mark. That is a question mark where we would like you to click on it and submit a question. And also, it would be really helpful if you could say who you'd like to answer your question. And we'll be taking those in about 25 to 30 minutes. I would also like to encourage you to tweet using the hashtag FutureHealthLives. So, data-driven solutions, what do they look like, and how are they going to help us reduce health inequalities? Well, I'm delighted to say that I've got 6 health experts here from the private sector, the public sector, and from all corners of the globe. So I'm going to briefly introduce you to them. There is Marcelo D'Agostino, who's a senior advisor for information systems and digital health at the Pan-American Health Organization. We have Professor Tõnu Esko, who's the head of the Estonian Biobank Innovation Center. We have Tony Estrella, author, futurist, business leader, and strategist in health tech based in Singapore. Thank you, Tony. And we have Steve Guise, global head of Pharma Informatics at Roche in Switzerland. Welcome, Steve. We also have Professor Joanne Hackett, who leads the healthcare practice at IZY Capital in the UK. Professor John Lim, Executive Director of the Centre of Regulatory Excellence at the Duke-NUS University of Singapore Medical School. I haven't done them justice. I've just given them their main title. And if you would like to know more about them, you'll find their bios, which are on the landing page. And they're very impressive too. Now, the way this is going to work is that each speaker has 3 minutes. And then I'm going to ask another speaker to pick up the baton and give a brief response, most probably less than 1 minute. And then we're coming to our audience. So please start submitting those questions. I'm going to start with Marcelo. And it's obviously crucial, Marcelo, that these organizations, they build these data-driven platforms, these ecosystems. So what I'm wondering is, how does this apply to health systems, and what steps need to be taken to help them make this digital transformation?
Thank you very much, Claire. Thank you for the invitation also. Well, I will go directly to the answer. Honestly, I can't imagine today a health systems or any health-related institution without a data-driven platform. But also, and more than that, I cannot imagine from now on any health-related institution without a digital health and information system strategy, but that is also supported by a dedicated entity and a change management strategy. This is critical today because we are facing a lot of changes in health systems. The first thing about steps, the first thing seems to be simple, but it's not, is to accept that digital transformation of the health sector is to position the health sector into the digital age and not just filling institutions with computers and softwares and apps. I have a friend who is telling me we have a lot of apps here looking for problems there. So we need to understand this concept of the digital age and to move the health sector to the digital age. But also, if we want to have data-driven platform, we need to work on the foundations. We need to have a clear data governance strategy. We need to have guiding principles. We need to have data sharing agreements. And this is key because today we have the health sector needs data that come from different sectors. We cannot still operating with the concept that all the data that is needed for the health sector is under the administrative authority of ministries of health. We need data from education, we need data from finance, but also we need to understand and incorporate new concepts like online social behavior, unstructured data analytics. These are new concepts still for public health, but we need to embrace all of them if we want to have data-driven solutions for supporting digital transformation of the health sector. And something that is critical is to understand that digital transformation of health sector needs to be part of the process that almost all the countries in the world are doing of digital transformation of government. We cannot think on isolation, the health sector here and the rest of the sector there. So we need to ensure convergence on digital transformation of government. And to finalize my statement, I want to reinforce the concept of that we that are very connected with the digital world, we need to think on strategies for the ones that are disconnected. As you mentioned in your opening, we cannot proceed without taking into consideration equity issues because we have millions of people that are still disconnected from technologies. So I will stop here. Thank you.
Marcelo, thank you very much indeed. It's not business as normal. It's essential that there are these platforms, and of course there's the equity issue that it has to be data for all. Tõnu, could I ask you to quickly respond to what Marcelo has just said?
Yes, thank Claire. And one good example is efficiently working ecosystem where both academic sector, public sector and academia come together and, introduce a digital solution for the need of action is Immunity Passport that I'm working with a team of startuppers. And this is a solution that allows to really securely and in a digitalized form, check the immunity status of the COVID immunity and to be able to open up the economies and open up the countries. So it's important to join the forces of academic sector, public sector, and then build on the experience and efficiency of businesses. So thanks.
Tõnu, thank you very much. Yes, indeed, reinforcing the point of public-private partnerships. And thank you very much for that concrete example. I always think that concrete examples help people understand some of these concepts, and your discussion of this digital immunity passport. Thanks, Tõnu. Let me move to Steve, because I think that it most probably is true to say that COVID-19 has accelerated, perhaps even forced digitalization of health systems. And I'm wondering, how can the private sector play an enabling role in supporting the digital transformation?
Yeah, thanks, Claire. Thanks for the question and the opportunity to join you today. I think the private sector can play an enormous role. I think when it comes to a global problem like we are facing right now, actually large multinational companies that work with healthcare ecosystems across the globe can also be an integrating force to bring together our response so that it's not purely a national response. And of course, with our medicines and our diagnostics within Roche, we're bringing global platforms to bear for the kind of identification of patients with the virus and then with immunity, hopefully from our antibody test. And these are global solutions. Of course, medicines are already a global system. But what we find when we're integrating those solutions locally in ecosystems is the data infrastructure, the underlying healthcare informatics systems are very local. And at best, you could hope for national systems that you can integrate with. But in many countries, even within the country, you have a very fragmented approach. So I think a public-private partnership in the new era post-COVID could really enable us to think about how do we look at these things more at a multinational level, perhaps looking at bodies like the EU as a good starting point, which brings together already many countries to come up with common solutions and common approaches. And we are ready as a global partner to play that kind of role. And I think other companies, other sectors, the tech sector are also very willing to play a role. But I think what's key is that there is a will to work together as a global community. And I think that the technologies are there to integrate data along the patient journey, from diagnosis to treatment to disease monitoring once people are beyond treatment. But I think rather than doing that country by country, I think I see a great opportunity now post-COVID to try to look at these opportunities more holistically. We're also, of course, looking at how we can use digital technology in our company to accelerate things. Using real-world data internally, we can also drive our R&D productivity, enabling us to bring medicines and diagnostics to patients faster. And also, I think there's a huge economic benefit out there. There was enormous amounts of effort and money spent in healthcare systems which could be optimized and maybe even eliminated through the use of technology. So that's the kind of role I think we can play. We're already doing that at the national level in many situations, but I think the key unlock with COVID-19 is the ability to work multinationally, really a kind of cross-country, maybe even global solutions to these kinds of problems.
Yeah, thank you, Steve. Indeed, to stop the fragmented approach of each country doing their own thing, but to have this holistic approach. And of course, multinationals have that framework to do that. Thank you for making that point so clearly. And let me ask John Lim just to make some observations on what you've heard from Steve. And John, you might want to unmute yourself. Are you able to unmute yourself?
I'm unmuted as far as I can see.
Okay, lovely. So, John, we're not going to dock you points there. Please, I hope you heard what Steve said. And please respond. The floor is yours.
No, in my defense, I don't think I was the one muted. But anyway, my immediate response was, I think we have to manage the cross-transnational issues. And that's the biggest challenge when we're thinking of dealing with digital equality and equity that was mentioned earlier. And we have to look at the regulatory systems, not just within countries, but across countries. So I think these are things we'll have to think through very specifically, both at a national and transnational level. So that's my immediate response. Thank you.
Thank you very much, John. Let me go to Tõnu there. And we've seen that the use of telemedicine has really skyrocketed in the current crisis. So we'd be mentioning equity. How do you see that digital health would allow us to leapfrog so that it could increase health coverage and it could reduce some of these health inequalities? Tõnu, can I just check that you're hearing me correctly? Tõnu, if we can't hear from Tõnu, I will certainly move on, and we will come back to Estonia. We have not forgotten you. John Lim, let me go back to you. And you were mentioning this before about governance, but let me get a little bit more from you about what governance mechanisms need to be in place to encourage global coordination and promote the uptake of digital health solutions?
Thank you, Claire. I think there are three critical areas when we're thinking of this. The first one is ensuring interoperability, because without this, if you can't have data being transferred, whether within a country or across countries, there's going to be quite a major issue. But I think the governance platforms for this, as well as the infrastructure, varies quite considerably, and this needs to be addressed. Otherwise, we're not going to be able to achieve this at a global level. The second aspect is of confidentiality of data. Now, arguably, one could say that because of the COVID crisis, in fact, resistance to sharing of data has in fact gone down quite considerably, for example, through contact tracing devices, which many countries are trying to bring out. And whereas previously one would have thought that people would be resistant to this, there might be a great deal more openness. Having said that, I think there are still a lot of cultural differences in terms of how one agrees to data being shared, and I don't think anyone can fully get away from that. So concerns about breaches of data, especially health data, need to be addressed. That's a significant governance issue, and countries as well as regions and globally, there has to be a way to address this. And the last point really is this issue of equity. How is one really going to ensure that everyone has access to similar health models? And telemedicine really does begin to offer that, because I think you can have a lot more democratization and access through telemedicine. But again, governance systems have to be put in place to ensure that people are confident of it, and also that it's not abused in any way. So those are the three key areas that one has to look at in terms of governance and regulatory challenges. Now, how would one actually address that? I think you really have to start, of course, within respective countries' infrastructures, but I think regional and global platforms are very useful for enabling this to happen. So, for example, in my part of the world, I mean, within East Asia, there are groupings that work on this, and certainly across the Asia-Pacific, the APEC platform is a very important and significant area where issues like this can be addressed in terms of addressing governance and regulatory issues to facilitate digital health. So I would just leave that with you, Claire, and maybe we can come back to this later. Thank you very much.
Certainly, I'm sure we'll be getting some questions on the issue of privacy and regulation. Let me bring in Marcelo to respond to what you've just said, John. Marcelo, a quick response to what John has just said.
Yes, the quick response will be I will copy and paste what John mentioned, but in addition to that, I think that we need to support global coordination with standards and principles. I always think that it took years to define 8 principles for the Open Government Partnership, to define principles for open government data, but also to consider disaggregated data at subnational level. If we want to have good predictive models, we need to get data that will help us to identify the people that are under conditions of more vulnerability. Thank you.
Thank you, Marcelo. I'm now going to bring back Tõnu into the conversation. John has already mentioned telemedicine. Tõnu, we were talking about the fact that it's really skyrocketed during this crisis. And I'm wondering whether you see that digital health and solutions like that can help us leapfrog so that we can increase our health coverage and reduce some of the health inequalities.
Yes, thank you, Claire, and apologize for the technical difficulties. While Estonia prides themselves as being the most tech-savvy nation, still sometimes think. So to come back to the telemedicine question, I think the core, what is needed is more digitalization and more standards, because we cannot offer telemedicine solutions to our citizens if we are still using paper forms. And a nice example here is in Estonia, where 99.9% of the prescriptions are digital, which means that all kinds of different smart solutions could build on telemedicine. Another very important aspect to unlock telemedicine for crisis and in general is actually the use of data and providing the services has to be transparent and it has to be secure. So the citizen must feel that the health data that they keep very much close to their heart and is very, very sensitive, that this is, very securely held and tracked. So in case of Estonia, where we have nationwide electronic health records active and seen by basically any doctor working in Estonia, every time a doctor uses or looks at the record, there is a mark, there is a trail, and it's written in blockchain, which means that it is immutable and highly secure and trackable. So again, much more secure than any paper can ever be. And for last, it has already been mentioned by Steve and others. It's really, really important that there is a strong connection and collaboration between public and private, because many of the solution, especially in the case of crisis and urgent need, actually came from industry, because there was freedom to operate. They had available resources, and there was a need for quick action. And whereas the lack of things, lack of actions and services actually came from the disconnection between the public and private, where a strong collaboration would have enabled a lot of strong and innovative solutions. And I already mentioned this immunity passport. I think it's a very nice example how securely data can be managed, and something that immunity status that can be used to classify people or discriminate, if it's done very securely, can open up the economies and states extremely quickly. So thank you, and I leave it with you, Claire.
Thank you very much, Tõnu. And we all know that Estonia is the poster child for technology. And as we can see from the work that you're doing on the immunity passport. But let me move to Tony just to reflect on what you've heard from Tõnu there. Tony. If you would like to restart your thoughts there, Tony, that would be great.
Thank you. I think it's fantastic to hear examples like Estonia, and even where I live in Singapore, where there is a large amount of digital support for people. I think that we can see from the other events in the world that are happening right now around inequality that we also need to consider the community element of delivering healthcare. How does any intervention or any interaction get to that last mile to every individual who, to your point that you started with, Claire, does not necessarily have that same level of technology access? And I look forward to maybe discussing more of that in the Q&A section around how we can consider options to deal with all aspects of delivery of care in an equal way.
Yes, indeed. Data for all, a point that all of our speakers are making there. Joanne, let me bring you into the conversation and ask you, what do you think is the next step that we need to take so that these data-driven solutions can be used to bridge gaps in health systems? Everybody knows that it needs to be done, but what would you say was the next step? And if you can give us some examples of partnerships or even applications that have worked well.
Great, thanks, Claire. Yes, I think one of the things I often say is that we all have wonderful healthcare systems in the countries that we live in, but we actually put an unfair demand on them, which is asking them to innovate, asking them to understand how to incentivize partnerships, and asking them to really be the jack of all trades when it comes to delivering a quality healthcare, but staying very innovative. And I think one of the things that this pandemic has highlighted is that there is a plethora of expertise out there that sits outside of our healthcare system, as it should, but there are partnerships that can actually be delivered to enhance the abilities of both the provider and the supplier. So I think we are unfair sometimes with our healthcare systems by demanding them to stay very active in this space. And I think there's a real responsibility for us now to look at utilizing technologies that exist to be able to pull through. We keep talking about data, so all aspects of data. I think there's an opportunity for us to push more into citizens, the idea that they are being empowered to be able to embrace this opportunity. So there has to be technology that exists to be able to do this. And when you think of other industries, this actually happens all the time in a much easier and more streamlined way. So I think we have to be more responsible with our demands to the healthcare system and really embrace the partnerships that we really can. So when you think currently in this pandemic, there has been an amazing call to action when it comes to looking at the pharmaceutical companies and the healthcare system to try to derive a vaccine for COVID-19. And in addition to that, there's been many other examples where there has been a technology provider. I'm going to be agnostic here, so it could be any of the large cloud providers, for example, and they actually provide that platform to allow data to be federated. And we often forget that the data that's coming out of our healthcare systems in isolation is actually quite useless. If we want to really be able to empower healthcare to change and to allow us to treat individuals better, and even more importantly, prevent them from getting sick, we need to actually harness that data globally. So there need to be systems that can scale. There need to be incentives in place for people to want to do this, be they the individuals inside a healthcare system or the technology or the pharma providers on the outside. And I think we just need to be a little bit more realistic about what it is we're asking our healthcare system to do, and actually ourselves push forward the opportunity for being a little bit more open with partnerships. We very clearly go on to websites all the time. We click the I accept box when something pops up saying, do you X, Y, Z? We don't even know what half of that means. And that is our trade-off. So we need to push that back to citizens and to the individuals who are responsible for allowing our healthcare systems to work better, and let them know that there are opportunities to trade information in order to have these very fruitful partnerships.
Thank you, Joanne. Indeed, it's a collaborative effort and not just the responsibility of the healthcare systems. Steve, you were nodding to what Joanne said. So if you would quickly like to respond to her remarks.
Yeah, I would just build on the point I think that's already been made, is that I think patients, well, let's say people are generally more and more empowered in their daily lives. And I think in healthcare, they would like to be more empowered too. They'd like to have control over their data and also have the choice to offer their data into a collaborative effort to help public health. And I think if we can provide the kinds of data sharing frameworks and manage consent at an individual patient level, I mean, we see clinical trials how willing patients are to share their data if they know it's going for a greater good. And I believe that if we can provide that kind of infrastructure and engage patients, they will volunteer their data to be used for broader public health opportunities.
Thank you, Steve. Let me bring in Tony Estrella there. Steve was talking about people need to be empowered, and indeed with smartphones, we now do have power and diagnostic capacity at our fingertips. How do you expect this to shape the way that people think about health in the future? And what do you see as the first one or two relevant first uses of technology for people today?
Great, thank you. So I'll take a portion of Asia to answer this question and focus on Southeast Asia and the collection of 10 countries there. And you can see that mobile first is a mindset that exists, and in a way that one of the benefits for this part of the world is that there isn't a lot of legacy healthcare to interact with before implementing new solutions to very difficult and challenging problems. And we mentioned telemedicine earlier, if you look at companies who do telemedicine in this part of the world, there's rapid adoption increases, 60% plus, an example of a company called MyDoc as one example, primarily from Singapore and a little bit from Hong Kong. We're also seeing that people's empowerment is one component of how smartphones are transforming the way that healthcare is delivered, but it's also impacting the entire interaction between stakeholders within the healthcare ecosystem. Digital pharmacies is another example where the use of smartphones has transformed how people think about and interact with getting their medications. Even the pharmacists themselves have a different mindset for what their expectations are for the tools that they have to be able to understand their interactions with the people who come in. So that leads to, say, example like M-Clinica, who has a 150,000 virtual network that reaches 150 million people across Indonesia. And I'd say one last example would be in the area of radiology, where this is a very data-centric environment. AI should be transformative technology to help, but in a way, you still need a very specialized group of radiologists to be able to look at one scan and be able to look at all the different potential things that could be identified within those scans. And AI still needs to be trained. So there's roles for existing providers and clinicians to marry their expertise with technology. And a company like LifeTrack Medical Systems is really looking at delivering a new method for low bandwidth transmission of X-rays and other medical imaging to radiologists who are in short supply for the region. So various challenges that can be tackled with technology across the space.
Thank you, Tony, for those very concrete examples. And just before we go to the audience, because we'll be taking your questions, let me ask Joanne to respond to what she's heard from Tony.
I completely agree, and I think one of the things we need to be very careful about is actually trying to create another problem. There are lots of solutions out there that address questions that are relevant to the healthcare sector but aren't actually in there today. So let's think about some of these existing technologies and actually flipping them to be a bit more applicable. So there are ways that we can actually provide solutions faster rather than thinking we actually have to start ourselves and create something brand new for the healthcare space.
Yes, indeed. Repurposing. Now, I'm now going to open up the floor to the audience questions. So there's a question that's come in for you, Tõnu, and it says, in order to keep people engaged and supportive of large government and commercially driven big data initiatives for the public good, should there be win-win situations and direct tangible benefits? How have patients and their families who've taken part in large genomic studies over many years had any tangible or direct benefit? That's a question to you, Tõnu, in Tallinn.
Yes, thank you. And it's a really relevant question, and I definitely think that there should be clear win-win situation for the citizen and patients and families, not just because it's always elevating to participant in scientific studies and great new knowledge, but it's really motivating is something tangible coming back. And in the case of Estonian Biobank, we have actually delivered genetic reports back to close to 3,000 people, and they have received information about their pharmacogenomic situation, like what the dosage should be for certain medicine, do they have a high risk coming from a genetic profile, either for some inherited conditions based on one mutation or something that is more complex. So this is a real tangible benefit from the participants for this kind of big, mostly science-driven initiatives, but having this healthcare output. And another outcome from such a, our big initiative is that the state has now taken the scientific tools, scientific discoveries, and is now building state solutions to make the prevention programs smarter and more efficient, so that you call back people to health check based on your genetic risk, and this way you are actually not using that much resources just with no good outcome. So thank you.
Thank you very much, Tõnu. There's a question here, Marcelo. We've heard a lot about there's so much information out there. People are talking about infodemics. And so the question is, have you found a solution to isolate and use quality data How do you sort out the data that's actually usable and able to provide you with the insights you need, Marcelo?
Thank you very much. This is one of the top priorities today at the World Health Organization. As the Director General mentioned, we are not just facing a pandemic, we are facing an infodemic. There is no solution there because this is something that is not new. We have an infodemic before the current situation. We did an analysis with dengue, Zika, and chikungunya at the time. This is a critical issues in the Americas. And just for you to know, if you need to read everything that is published on peer-reviewed journals or quality-based content that is available on dengue, Zika, or chikungunya in 1 year, you will need 50 years without sleeping to read or to consume everything that is there. So something is wrong. There is no answer for that. We are working with fact-checking mechanisms. We are trying to explore artificial intelligence on that. But the key issue is a long-term solution that should be related to education. Education on what to search, how to understand what is critical information.
I'm sorry, Marcelo, we lost your last words. I don't know whether you can finish that sentence or whether we've got a connectivity issue there.
Okay, my point was that there is no short-term solution, that we need to start thinking on education on how to search, what to search, where to search, who to trust, etc. This should be a long-term solution. There is no short-term solution for the infodemic right now.
Thank you. We heard you loud and clear there. Let me now ask a question to John Lim, which says regulations on data as well as citizens' approach to data privacy differ greatly across the globe. Indeed, you mentioned this earlier, and is seen as a hurdle to global cooperation of healthcare systems. What solution do you see to that, if any? You mentioned there were cultural differences, but what can be done about that to get global cooperation of healthcare systems? John.
Thanks, Claire. I think the fundamental issue in any regulatory system, whether you're thinking of within a country, across a region, across the globe, is the issue of trust. And you really have to have trust in whoever is implementing those regulations and ensuring that whatever you're trying to manage is actually looked after well, especially in terms of data. So that's quite critical. Transparency and good communication is the other thing, which sounds like a nice soft skill, but in fact does have to be taken very seriously. So I'm just citing these two issues first because they're quite fundamental. If you're not going to be able to solve these within a specific context, to be able to address this globally is going to be very difficult. A simple issue of trust and transparency, just an example I would quickly give, is these devices for contact tracing. So in Singapore, we had this very interesting case where we were going to roll out Bluetooth devices, which of course you need 75% of the population to accept before, or to actually upload before it's going to be workable. And immediately there was a question raised, will privacy be affected? Will confidentiality be affected? So our minister in charge of smart nations immediately came out and said, these are devices that are not internet linked. It's not GPS. It's like a personal diary. And it's just a question then of a more public altruistic sense that you do need to have this to be able to facilitate contact tracing. Now, how does one address this at a global level? I think there has to be a lot of sharing of best practices. Standards was mentioned. I think the WHO has to come in quite significantly to help address this. And the other thing is to realize that referencing and reliance on systems addressing a very new area like the regulation of digital health needs to come in so that not everyone is reinventing the wheel. If you have the standards by global organizations or developed countries helping developing countries in this area, that's going to be a major move forward to dealing with this governance issue at a global level. It sounds simplistic, but I think we have to start there. Thank you.
Thank you very much, John. This is a question for you, Steve, coming in from the UK. Panelists said we need to work together across countries and sectors to move towards global solutions, and that clearly requires collaboration. Why would the private sector, and more particularly pharma companies, want to share data? Isn't that akin to giving away their competitive advantage? A question there for you, Steve.
Yeah, I would say that actually pharma companies and we as Roche, we already share our data quite openly. So the data from our clinical trials, any academic group who wants to actually analyze that data can apply to get access to it, and we share that data quite openly. I think there's a greater willingness to share than perhaps people appreciate. What people would want to ensure, though, is the reasons behind sharing it are, altruistic and therefore the benefit of public health. And I think you've seen already in this crisis, pharma companies, collaborating quite strongly in terms of even production capacity, of how they might scale vaccine production. So actually, in times of relative calm, perhaps things seem more competitive than they are and need to be. And actually, during this crisis, I've seen an incredible willingness of traditional competitors to work very collaboratively together.
Yes, indeed. I know that the International Federation of Pharmaceutical Manufacturers and Associations has really led that initiative of its members to collaborative data sharing. Indeed. Let me ask a question to Joanne here. You mentioned earlier the need to incentivize data sharing amongst citizens. For instance, the EU is currently thinking about data altruism, whereby patients would proactively share their health data to benefit the common good. Do you think this could be a successful model, is the question, Joanne?
I do. I think, and the reason I think that is because there are examples of this already. So in the UK, Genomics England conducted a very large study, had individuals' whole genome sequenced, and the purpose of that was to look for rare diseases and cancers, and to obviously try to be able to garner the insights needed for companies like Roche to be able to make the better medications more suitable for the individuals who need them. And all of these individuals consented for two things. They consented for research and they consented for recontact. So that doesn't sound like all that much, but what they wanted to do was, some of these individuals will never get a diagnosis, some of these individuals will never get anything back from being part of this study, but they know that the aggregation of that data is actually going to provide insights. So rare diseases, for example, there may be 10 people in the whole world that have a particular rare disease, and if there's never going to be a drug manufactured in that person's lifetime, you might think, well, why would they want to do that? Well, when you're looking at data, that individual is potentially a normal data point because they have an abnormal potential area on their gene. But also, if there's 10 of them, there actually might be 100 more out there that no one knows about, but you're only going to ever know that once you start seeing patterns. So people are starting to realize that their unique little blueprint is actually super amazing, because it's not just they themselves that you're going to be able to tailor a medication or a drug for. That's not really personalized medicine. Personalized medicine is being able to contribute a data point to be able to make inferences that are actually going to be applicable to many, but also unique to you. And this is extremely important for adverse drug reactions. You wouldn't want to be given a medication if it's never going to work for you, but you wouldn't know it's not going to work for you until you understand what's normal and abnormal. So I think this is quite an important thing, and I think the more citizens realize that we're all unique, we all have mutations, abnormal or normal, there's nothing actually wrong with any of them, it's just the way that we are, but we need to unpick that to be able to find out how we can be treated better and actually prevent ourselves from getting sick. So this is definitely something that is being looked at, as you rightly pointed out, in the EU in particular.
So I've got a question from Mohammed in Australia. And it's to Steve, John, and Marcelo. So I'll go in that order, first with Steve. And it says, in Australia, we have a conservative view of public health data, and therefore we have less transformation of these data into insights that have value for the public good. What is the panel's view on data democratization of public healthcare data for the common good? In other words, what measures should governments take to ensure publicly held health data can be used to provide insights benefiting society? Okay, that's quite a long question. I'll go to Steve, I'll go to John, I'll go to Marcelo, and if anybody else wants to chip in, please do, in the spirit of being democratic with that question. Steve, please. Do start.
Yeah, so maybe I can start. There are two sides to that. I would say if you look at aggregated, anonymized patient data, then I think the concerns around privacy can be largely overcome with the right level of aggregation. And those data can still make a huge benefit to medical research and can be used to develop new medicines, new approaches. And I think it's hard to make a case against that. I think when it comes to sharing individual patient identifiable data, that is a key cause for concern, and there needs to be appropriate frameworks behind that. I think in some cases, governments may take a stronger view to those topics than maybe individual citizens would if they were given the choice. And I think if you actually look at how positions may shift post-COVID, I think it's actually worth a kind of broader conversation in society as to what is the value of sharing this data for the greater good, and are people more willing than perhaps we initially thought to do so?
John.
Steve, the first point on anonymized data, I don't think is really the issue, because that already is sort of in play when it comes to research. But the second one is really very interesting as it's unfolding now in the context of the pandemic. But I think whether you're thinking of a pandemic or under hopefully more normalized conditions in time to come, one way one could address that, and again to strengthen the trust in terms of how governments handle data, is to set up that really are sort of authorized to manage this well. It could either be a government body, a third-party body, but it must be a trusted agency that manages that data, and then it becomes much easier to address this particular concern. So I think that's a critical factor, and it would vary from country to country because, I mean, there's a high level of trust in the Singapore government, but it may not be a similar sort of issue in other countries, whether in the region or elsewhere. But I'm sure there are bodies that citizens would trust to handle such data. Thank you.
Marcelo, there we are. From the trustworthy PAHO, what would you like to say?
Well, I will fully endorse the concept of democratization of data, because we all agree that we need to take care of privacy, confidentiality, security, cybersecurity. This is something that is bigger than health, because there are discussions related to any other type of data. We strongly support that concept. We will publish a paper very soon, not only on data. We are trying to push a new concept called the open public health, because we want to publish open data, open access to content, open access to educational material, open access to open source for algorithms, etc., etc., etc. But respecting also some criteria that should be respected on privacy, ethical issues, ethical use of data. But we fully support the idea of democratization of data.
Tony Estrella, let me bring you to the conversation. Yes, would you like to say anything about what has just been said? Otherwise, I've got another question for you about digital health literacy. There we are. In this game, you have a choice. You wanted to make a point.
I wanted to make one quick point, and then happy to answer the digital literacy question as well. I would just say the concept of democratizing data is also enhanced by having in parallel private-public innovation activities such as sandboxes, so that there could be immediate visibility on what the output of that data can be to help people and improve health outcomes. So this way there's an effort to help figure out what the right way is to democratize, but also see results. Back to you.
Tony, the exact question for you was about the digital health literacy. Why should the governments and local communities and institutions, or what rather should governments and local communities and institutions do to increase the health and especially digital health literacy of the patients? A question for you, Tony.
A good question, and I think it goes back to community. I think that this is something where the people who may not be as digital savvy should be the emphasis here, to try to understand what is that base level of information and education that they can receive, so that they feel included in this wave of transition and transformation. Using Singapore as an example, right? The mechanism to communicate updates on a regular basis was deemed to be WhatsApp, right? And that was because majority of people could find and could use that because they're using it in day-to-day life. And I think that mindset can be prevalent to figure out what exactly do you need to create literacy by starting with the group that has the largest challenges.
Thank you very much. I have a question here, Tõnu, for you, a technology question. What is your view on blockchain technologies enabling trustful data sharing?
The core of the data sharing is this underlying trust question, and this is mentioned by all the other panelists as well. And what the blockchain enables, it enables us to create an image of the log file, or other words, we can make a log file of someone looking at our data, and this cannot be deleted because there will be a mark of it. So basically, by implementing a blockchain around data usage, gives us a tool or an auditing platform that allows us to see who did what with the data, and similarly, like Tony mentioned, this sandbox solution where real outcomes from using the data could be visible. The same way, using a blockchain gives us a tool to really make sure that no one is misusing the data, or if they are misusing it, it can be traced very easily and proven way.
Thank you very much, Tõnu, for that one. There's another one that's come in for you, Tõnu, from London. How do we ensure humanity and dignity in patient interactions is still captured in digital transformation, perhaps even augmented, even more than ever, as patients are fearful, confused, anxious, and perhaps feeling helpless? So how do we ensure that these interactions, when they're done digitally, are humane and dignified for the patient?
Yes, thank you for the question. And I think we all have learned from this past COVID-19 crisis that having telemedicine solutions or having or digital meetings actually is not scary at all. And we, at least myself, have experienced very pleasant ways of actually having meetings, not needing to travel hours. But the same, actually, what helps to take away this fear about big data, genetics, complex issues of healthcare is actually public outreach and public education on explaining very clear and simple ways what are the genes, what they do, what they don't do, how you can be or couldn't be misused. So I think the public education and understanding of the solutions is really core here.
That question also on how we ensure that patient interaction is humane and dignified, with people being rather fearful in this crisis. The questioner would also like to have Tony's opinion on that.
Yeah, I think that there's a lot that's been written about how AI will be shifting many types of jobs, and I think in the healthcare sector, what it does is it brings the need for empathy and emotional connections to the forefront. And if we go back to the radiology example that I was saying earlier, when a radiologist is the person who delivers the message about what someone is suffering from, that message can be delivered with a lot of empathy because it's still coming from a person who is trained to deliver difficult messages in a way that can be accepted in a one-to-one conversation, versus simply having a piece of paper or an email message or a message saying, this is what's wrong with you. So empathy needs to be at the core for that discussion, and how to make sure that people still feel included and taken care of and safe.
There's a question, it's quite a broad-ranging question here, for Joanne, John, and Marcelo. So Joanne, let me start with you. It says, what is the role of public and private organizations in reducing the prevalence of medical misinformation online and the associated impact? Joanna, and then I'll go to John and Marcelo.
Yes, I think this goes back to a point that was made earlier. We certainly don't lack information in the world today. It's trying to actually distill the important points. One of the things that happens a lot is that pharma companies in particular feel they have to really explain in great detail why and how. And very often that actually is complicated. It's complicated because most people don't speak that language. So it's actually quite a difficult one to balance, because you want to present the truth, but you want to present it in a way that's digestible, and various people have various levels of expertise. And I think there are standards that need to be adhered to. But in addition to that, I think if there is the outcome as to what you're trying to solve is a bit more clear, and then work it backwards, and people can understand, I think, a little bit better that way. But more often than that, I think it's when people get confused about off-label use and just buzzwords that they don't necessarily understand. It's usually because the private institutions are trying extremely hard to be as truthful and transparent as possible. But I think there's been quite a lot of work to try to understand what language should be used consistently. And again, this will change based on which country is adopting these regulations. But understanding and pressing for a more uniform approach to that is probably the best way for us to be thinking about this going forward.
John, anything to add to Joanne's answer there?
Thank you. So I agree with Joanne. I think some consistency in simplicity of language helps. But again, I think this question of public-private partnership is useful because picking up a point Joanne was making, if the information, let's say, is purely from the industry, there would always, I suppose, be a suspicion that there is a certain bias. And I'm not saying that there is, because quite often times it's very scientifically robust and neutral. But I think when you have other bodies, so for example, because I'm working now in an academic setting, and I was the former head of the regulatory agency here, I can see this shift. As a regulator, you want all these specifics there, almost in a sense to manage all the legal fallout, as it were. But now from a more academic teaching situation, we do need to simplify things. And so I think as these partnerships come together simply in terms of information, it does reinforce not only understanding, but this word of trust that we keep using at this session, which is so critical, because misinformation, if it's only from one source and not validated by another or coordinated from various sources, I think raises more suspicion than if you have partners in the game. So I think, again, partnerships very important in this area.
Marcelo?
Yeah, thank you. Well, I fully agree with the previous speakers. In particular, what Joanne mentioned about language. We need to understand also the way that people are searching for information. We normally believe that we know the way they are looking for information. If you look today, for example, at Google Trends, you can see that 95% of the people are still looking for using the word coronavirus. They are not using COVID-19, COVID/19, but we try to focus on what we believe is the right approach for communicating that. Other thing that we need to understand is multilingual and multicultural aspect, because just in one country, in South America, we have 17 ways to say face masks. So if we want to reduce the infodemic, we need to understand also the way that people are talking, the way that people are searching, because if not, and the last point is for me is very clear. We all need to play a role there. And we always say, if you are not 100% convinced on the information that is in your power, do not share that. Because you have followers, you have people reading what you publish. So if you are not 100%, and with that, you will stop a lot of other people, let's say, forwarding wrong information to plenty of other networks and people everywhere. So we all need to play a role to reduce the infodemic.
I'm going to take one more question in a moment, but just in the spirit of transparency, there were some comments there about the pharma industry, Steve, and the need for simple language. I wondered whether you wanted to pick up on anything there.
Yeah, I mean, I think there is an incredible amount of complexity in some of the language which is used to, I mean, you only have to listen to an advertisement in the US for a medicine to listen to all the small print that's kind of given. And I sympathize with both the need to be transparent, but also make it digestible and understandable. I think there's no easy path for that other than really we try to educate the physicians that are facing patients and that they can explain the complexities in more simple and understandable terms. But increasingly patients want to educate themselves. So we are putting more resources out there for patients to directly, interact with our resources, which are really designed for patient consumption. But there's no easy answer, I would say. And I think this is why healthcare professionals, doctors in particular, play a key role in translating the medical narrative to something that really makes sense for patients.
There's one last question. I know that we're a little over time. Well, it's 1 hour, but fortunately this is not a BBC programme, and I understand there's a little bit of a leeway there. So I'm going to ask one last question before we conclude. I think, and I'll come to you, Steve, and then to Tony, and then to Tõnu. And the question is, would you expect digital patient engagement to increase and become the new normal post-COVID-19? Could there be an uptake of digital patient interaction in clinical drug development? So, Steve, if you want to kick off with that one, and then I'll go to Tony and then Tõnu.
Sure. I mean, I think this was already started prior to the situation we're in now. And I give you a good example in multiple sclerosis, which is an area that we work. A patient with multiple sclerosis may see their physician twice a year, and their ability to recall their symptoms and their progress in their treatment is pretty limited, and data shows that maybe they can accurately recall 7 to 10 days worth of real experience. But if you couple the treatment with a digital health solution that can really monitor digital endpoints of motility, precision with being able to do certain tests on a smartphone, you can get a much more, it's maybe not more accurate, but it's more longitudinal, and you can see trends in patient response to treatments.
Oh, I think we lost. Sorry, we lost a bit of connectivity there. Very rare in Switzerland, where I'm already seated. But I think, Steve, that we got most of your message. Thank you very much for that one. And I'm going to go to Tony Estrella about, are we going to see more digital patient engagement in the future?
Yeah, I think that's a resounding yes. And I think that it comes from, as individuals start realizing how important data, their personal data is as a point of interaction with different stakeholders, then stakeholders such as insurance, your employer, your medical professionals, being able to travel, all of those will start to create additional layers that ultimately will help you as an individual stay healthy, because your credit card bill is as important as your genomic data for helping to figure out whether you are going to stay healthy in the long term. And all of that comes together, creating more interactions.
And Tõnu, the last word goes to you in Estonia. Would you expect digital patient engagement to increase post-COVID?
Definitely, and fully agree with the previous speakers. And I think it's, there's always, saying that, don't waste a good crisis. And I think here it's really the case where we can use this past performances and the need to have telemedicine solutions to tackle and provide care. And I think it's not just for clinical trials, as was the question, but very much for state-provided services as well. So definitely, I think there will be many solutions going digital now forward. Thank you.
Thank you. Well, thank you, speakers, for joining us from all over the world. Thank you, the audience, for your extremely pertinent questions. And I think we can see that there is a momentum towards data-driven solutions. Perhaps we've always known what steps to take, but the challenge as always in life is actually taking those steps and deciding in which order they should be. And we hope that today's discussion starts you thinking about how we can really build on that momentum towards data-driven solutions. I would also like to thank everybody who's used the hashtag Future Health Live. The conversation continues because on Twitter and LinkedIn, there is Future Proofing Healthcare, where you are going to see more information posted. And if this discussion has really whetted your appetite for more, I understand that Tony Estrella is going to be writing a white paper on personalized healthcare, and it's going to be how that evolves in the Asia Pacific region by 2050. It's the first in a series of white papers that will come from around the world. So thank you everybody for your attention about data-driven solutions. We can see that it's the way forward and that the interaction between the patients and the professionals is going to be much more digital as hopefully we move out of this COVID-19 crisis. So thank you everybody for joining us from around the world, and goodbye.